All right, we're live. And welcome everyone. This is the moment you've been waiting for. How you feeling, Carolyn?
I'm feeling great, feeling great. This is new, but I can get used to it. I see that you just went live on. Let me see here.
Just when we went live, we are on Instagram, and we want you to kick back and relax. Everybody's excited, and we're looking forward to a wonderful presentation today. I am going to just we'll be making little adjustments, so we just want everybody to relax. This is really exciting for all of us.
Uh,
So, am I clear? Am I too loud here?
No, it sounds great on my end.
Okay,
Yeah, I can
very
hear
cool.
you.
So we're gonna
Can you
go.
hear me? Am I clear? Am I good?
Oh yeah, we got to get even. Yes,
No problem.
you sound wonderful.
Okay, great.
Okay.
Great.
So, yeah. So, what have you known about, or what do you think about the whole idea of, when you hear a word, or you hear words or phrases that you're not familiar with, and they may come from your doctor, and may come from your team, like even from the nurse assistants, all the way to the nurse practitioner. And it does definitely make a difference when we understand the terminology. So we're going to talk about that today. And one of the things that we want to do is make sure that you have the opportunity to share this particular presentation with everybody, because we're going to really divulge some of the things that will make you pretty more aware. We want to arm you with more awareness. So this is why we're doing this. So make sure that you get other people that are up now. They should have us on, because this is going to be a lot of really good information that you can put to work, and you can study it. The last presentation that we actually had a little. What is that? A quiz. So get you some tea, by the way.
Oh yes, absolutely. Can you still hear me? My screen is frozen, but if you can still
Yes,
hear me,
I
we're
can
good
hear
to
you.
go. All right.
Okay. So you
Okay.
got your thumbnail on.
No,
You just frozen.
it's
Uh,
so. Oh, it's not showing me at all right now.
yes, I see you, but it's
Okay.
just frozen.
All right. It's frozen on my end, but we can keep the show going. No
All
problem.
right.
As long as you can
Sounds
see
beautiful.
it.
So you want to go ahead and open up for us, Carolyn, and um, take it away.
Absolutely. Good morning to everyone. You are in the Mind of Nature, the new home of the Mind of Nature here on YouTube and Facebook, and also streaming on Instagram Live. Uh, this is Dr. Zarif, the nutritionist, who's here with me. I'm his co-host, Carolyn, and today's topic is understanding medical terminology. This is going to be great. I think this is really great because a lot of people go in not knowing what the doctor is talking about, and they're lost, and they feel like, okay, where am I? What am I supposed to do? I don't know what that means. And some people are actually scared to ask the doctors anything. They don't want to seem, look silly or feel like they don't understand, but really they don't understand. So understanding medical terminology for sure for us is definitely a need. So
Beautiful.
yeah, Dr. Zari, take it away.
Yeah, that was beautiful. Thank you, Carolyn. Some of the people that are here already: Sky Aim Productions, Lotto 8 million, 18 million, Dim Simi. We have Eclipse Soleil, and hey, long time. And Jedwa 330 is here, along with yeah, and some more people here. I just want to, would everybody mind if you just put in where you're from, if you're from Detroit or Cincinnati, or if you're from the West Coast over in Nebraska, California, where are you calling from? If you're in Nigeria, or if you're in Bangladesh, wherever you are, just put that in there so that we'll know how many people we're reaching and where you are. So let's get right into it so we can go ahead, and we do respect your time. So we're going to cover as much as we can. If you want to join us up on stage, check us out in the comments. All you have to do is just go there, click on the link, and the link will um, get you to the stage. So we're looking forward to join us if you like. If not, just kick back and relax and let us do it for you. And this should be a very, very wonderful discussion. Now, the reason that we were talking about the medical terminology is everything starts with us. Everything starts with yourself. So when we have been learning about the different terms and all the stuff that we've been learning as far as terminology, or the different phrases and that whole jargon or the language that is used in the medical society. You really feel that you're left out. You don't know what it means. A lot of times we nod our head like we do know what it means, but then we end up going home without really understanding what we just heard. So this is, I should say, something that is expected, and it's been something that needs to be changed over the time. Whenever you're talking to your doctor, it shouldn't be something mystical and you have to figure it all out. It should be something that is agreeable to you, or something that you disagree with. You agree? And that's what we're going to be talking about today. We also want you to go ahead and ping other people, get other people in here so that they can share with you. They can share we can share with them, so that they'll be able to get where we're going with this whole thing. And then we get a chance also to hear people's point of view. That's why we're doing this from Clubhouse to here, so that we can actually speak, and then you can come on and you can say what you want to say. Okay. So that is a beautiful thing. Keep in mind that we don't want to pontificate. We want to be concise, get straight to the point, and we want you to say things that are empowering. We're not just interested in hearing your beautiful voice, but we want you to say something with it, something that really counts. So, what should you know about yourself? We said that, first of all, everything begins with you. And the understanding of yourself makes all the other stuff that we're talking about, make sense. If it doesn't make any sense, what's the purpose? For years and years, what we've been doing is listening to people tell us things about their ideas about separation. I said that a little bit kind of twisted, but what I meant by this is that we have only been sharing, for the most part, our opinions and passing on a lot of folklore and beliefs. And that's cool because everybody got them. Everybody from every tribe, from every sector of people, there are beliefs. These you have every from Seventh Day Adventists, Islamic, Christians, Catholicism, voodoo, hoodoo, all of the black magic. All of this is a part of our culture. And when we don't understand some of the major approaches to keeping us healthy, it can cause us to, we simply ostracize the opportunity. So we don't really look at it as being an opportunity to learn more and to understand more. So we start with ourselves. Why do we experience a loss of identity? And one of the things that we start off dealing with, that the from the aspect of we or everyone else needs to um, own we need to own our own behavior. We need to take responsibility for our decisions. We need to do the things that will help us to transition from one thing to another. So when we talk about these things, we're not just talking about are you a vegan or what do you eat, and all of that isn't important, especially at this stage. Knowing what you are, knowing why you do what you do, knowing your limits. So let's go over some of those things. Well, one of the things that is so important is to make sure that your decision that you're making, you have some premise. It's not just, this is what I think. But when you're talking about medical situations, you're talking about a conclusion that have been reached by a process of diagnosis. And when you diagnose or you get diagnosed, you got the conclusion from a well-trained individual that have put years and years of study into the specialty that is appropriate for your situation. So let's get that very clear first. Doctors aren't just these guys that just walk around in lab coats. Now you have knuckleheads. I don't care where you go. If you go to get your car service, you're going to have a few. You may run into a few knucklehead mechanics. If you get in your lawn, if people are coming there just to maybe prune the bushes, cut the grass. Well, somebody on that team is going to be somebody that you guys say, excuse me, no, not right there, here, not just stay on this side. You're going to always have that. And that is the nature of humans. Now, what we want to do is make sure that we know what and who we are, because the things that we say, the things that we embrace, the things that we absorb, what we learn has so much to do with what you think about yourself. And if you continue to go like this, yeah, I heard that somebody ate some Asian pears, and then their whole life went backward, and they got younger and younger and younger. And he used to be 97, and today he's 12 years old. Well, see, that's out of some kind of movie or something. And when we listen to that, a lot of times, and we accept that, it makes it difficult as we're building our generations to come. So if we don't change this and we don't address these things, then more people will continue to use these um, type of approaches to teaching a person or to sharing a person, sharing with a person something that is, just like unbelievable. This will continue. So remember the even nutrition until we learn how to teach nutrition, we'll continue to approach it the same way. It's usually with a real heavy burden. I can't eat fish. I can't eat turkey. I can't eat beef. I can't eat pork. I can't, all of this. And that most of our rules for nutrition does not come from the hospital. It comes from our religion. And what we see in our religion is the way that, what we believe is our way of life, is our lifestyle. So when we're talking about our lifestyle, we're talking about the way that we live. And we're also setting these examples. If we continue pretending like we know what we're listening to, if we continue to pretend like we know which direction to take in order for us to be healthier and what to do for ourselves and our family, then we're also pretending to be well. We don't need to pretend, we need to be that. Okay, so we put everyone else's needs before our own when it comes to ourself. Getting back to you. We have the habit of putting everybody else's needs before ourselves. And when we focus on others, we neglect ourselves. We fail to recognize, and we fail to value ourselves and our needs. We minimize who we are, and we minimize what we need. So today, starting today, make sure that you take notes and that you pay attention to the things that you can do right away to make yourself a better person. And one of these things is to make a decision to make or choose or make a decision to choose those things that will embellish you, the things that will improve you. What can you do today with what I am saying to you and what you'll hear from other people? Another thing, when we're talking about ourselves, we're disconnected from our thoughts and our feelings. We commonly keep ourselves so distracted and numb with alcohol, with food, with sex, with electronics, whatever. We are just searching for this incredible feeling that we have. Is called utopia. And when we're feeling that utopic feeling, and we got everything rolling, and we have this feeling of this feel good, all of us love that feeling. And euphoria is another name for it. And this is something that we've been doing practically all our lives. Since we've been children, we see something that we like, we smell something that we like, our parents are eating the same thing, they pass it on to ourselves. I am not saying that don't eat any food or stop eating the way that you're eating. I'm saying that if you are about taking care of yourself, how can you put something in your body that does not resemble or reflect the thing that you are supposed to be becoming? What you're becoming, if you're becoming a king, if you're becoming a CEO, if you're becoming an entrepreneur, if you're becoming the leader of your family, all of those things entails a decision to treat yourself in a higher manner. If you're not eating the foods that make you stronger, that make you healthier, then you're negating the responsibility, and also you're negating what you're saying about who and what you are. How often do you reach for your phone and your or a snack whenever you get even slightly uncomfortable? And usually, when we reach for food, we're using that as some kind of cushion, and we eat it until we feel good, back to euphoria. So, this is why it's so important that you understand what you're doing with your time and your life so that you will make better decisions, informed decisions. And some of this, of course, some of us have heard other people speak to these same matters. But the idea is to have it automatic. Automatic means that you've been doing it enough for you not to even have to think about it. You get up and you're in gear. Now, these things keep us from knowing ourselves because we don't allow ourselves to be curious and ask ourselves how we're feeling, how we're really feeling, what's the truth about what's really going on with ourselves. So, this is another thing that you do when it comes to taking care of yourself. When we talk about taking care of yourself, it's very, very difficult. You can look at the numbers, how they go up, they go down, they go up, they go down. Why? Because most people are convincing themselves that they are worth taking care of, or they're worth doing something about, that they're worth taking care of themselves on a health tip. It's like, hey, I do what I want to do, when I want to do it, where I want to do it. So, yeah, to a certain degree, you're right. But remember, how you treat your body also reflects the way that you honor the people that love you. Um, we feel ashamed and unworthy, and consequently, we bury parts of ourselves. And we were told that we're bad, or we're told that we're strange, or we're told that we're ugly, stupid, or unworthy. We were criticized, we were teased, and all of these things have happened in the past. Even you have friends now, if you don't eat a certain thing, and like, man, come on, just take a bite of this. You crazy? You don't know what you're missing. So it's very important that you have your personal strength, so you can say no means no, and this really makes a difference when you're a person that you like to go ahead and do what everybody else is doing. It's going to be very difficult for you to make decisions on your better behalf. Now, some of the questions to help you know yourself better, let's go through those. Number one, what are my strengths? Do you know what your strengths are? What are your strengths? Number two, what are my short term goals? What are my long term goals? Now, if you don't have anything that you can do to reflect what your goals are, what are you doing today? You might have some idea, but I'm talking about what are you going to do as a collective to become something greater than what you are now? And your long-term goals, what have you started on? If you, Denzel Washington said the wonderful thing when he was giving a speech. He said that a dream is only a dream until you take that dream and make it a goal. It has to become a goal. A goal includes your start date. It includes your deadline. It includes what you're going to accomplish in that time. If you haven't made any goals, this is the time to do it. Write down, just look, if you just got a little sheet of paper, or you get some stickies like this, and you start writing down what you're going to accomplish. Look, you still got just a few months just before a new year. If you don't do these things, you go into another year and you're doing the same thing 10 years after. I guarantee you, because you don't have any direction and you're allowing to happen to you whatever. It is what it is. We adopt these different sayings that it gives us. They become a scapegoat, and then we just do silly things for the next 10, 20 years. And you look around in 20 years, and what have you accomplished? And this is what we want to change. We want to change it because being, again, a CEO or entrepreneur, if you're talking about making more money, you got to think differently. If you're going to, you can accumulate this amount of money, but what are you as an individual going to do if you cannot enjoy that, if you're preoccupied with sickness? Another wonderful point about getting to know yourself is, who matters most to me? Can you answer that question? Who matters most to me? Who are my support people? Again, who matters most to me? Do you know? Do you have people that you thought, who came to your mind right away as soon as you heard me say that? Who really matters to you? Who can you call when you need, or you're facing some kind of challenge? This is super, super important. So you get this down. This is super important. Who matters most to you, and who are your support people? You need a team. Don't think, hey, I do everything myself. I don't ask nobody to do nothing for me. I did it all for me. I even milked myself. Yeah, I did. I changed my own diapers. You have people that take this too far, and then they're repeating the same crap over again, over again, over again. Number four, what am I ashamed of? Is there something that's holding you back from being all that you can be? If you are, you need to let it go. That is just a form of fear. When you are ashamed of something, you're only as sick as your deepest secret. Let the stuff out. You've said it. There it is. It's out. My technique is, whatever's difficult, I say it first. I get it out there in the air and it's done. Now your technique may be different, but some people, everybody has the right to have their own style. But the main thing is that you want to reach that goal. You want to accomplish what you set out to do. And in order to do that, again, you have to have your short goals. This is what I'm going to do in the next 30 days. That's a short goal. Your long-term goal, this is what I'm going to do in the next 20 years. So this is what we want you to do. Start, planning. You must strategize. We must strategize. And I'll stop here for a minute. Let's go to Carolyn Gento over here. Carolyn, what you've heard so far, how you like it? I just wanted to get a little breather.
Yes, absolutely. Everything sounds great. One thing that you mentioned, making your goals and writing it down. For me, I'll make goals, but the issue is not writing it down. So that's definitely a note that I took to make sure that I'm writing things down. Absolutely.
Beautiful. Hey, I'm glad to. We got people in Detroit. Hey, I see my cousin, First Lady Sarita, is in the house from Detroit. Welcome. Welcome, much love, babe. Really, my wonderful family is like nothing would have. I just talked about it, having your support people. Here's First Lady Sarita is right here, right on time. This is really important. This is my cousin, and you might not have a cousin or even a brother or sister or something, but have somebody that's a part of your support team. Your support team, you know how bad we want to say, yeah, I got my manager, I got my agent, yeah, I talked to my lawyer, yeah, I got my accountant, my CPA. Well, you need to be also saying that, and my support group is. It takes a lot to maintain your wonderful self. So welcome, First Lady Sarita. And then we have D Coates, also known as Diva D, is in the house. Thank you and good morning to you, Diva D. It's good to see you here. Remember, those of you that want to come up on the stage, you can just see we have a link that I've put here in the comments, and you're welcome to the stage. We give you the opportunity because, sometimes early in the morning, we're not ready to go public. You know what I mean? So
Absolutely.
thank
I'm
you.
laughing because I'm like, yeah, that was me. I was like, wait a minute, let me get something going.
Right. There you go. I know. I appreciate you. I appreciate you because I know women have to get up a little earlier and do their thing. And it's worth it. It's worth it because you get a chance to share their beauty. Then we have my Leah. My Leah is here. Marlia Ayana Jones, Grand Rising. Grand Rising to you all the way from Vegas. And thank you so much for being here, getting up and going with it. This is, Marlia is definitely one of my favorite folks. She's brilliant. She's kind. She has an incredible family and a whiz of a mother, just a strong, strong, wonderful woman, and really appreciate you being here. Thank you very much, everybody. We got over here, we have Jamik. I think this is Jamik Mook. Jamik Mook or something, I think. Jamimuq. You say that one. I'm sure it's a beautiful pronunciation. We also have the UNHAEL is here. And we have Eclipse that is here in the house. And we have a lot of other people, Lotto underscore 18 million. And I think I said some of the other names, but thank you very much for everybody being here. We're going to go ahead and continue. We're talking about knowing yourself. So once you know yourself, then you have openness, or you have the attitude of inviting more and more people to your space, or you have you have more ways to choose what is working for you and what isn't. And if you don't know yourself, I don't care if people say, yeah, you don't eat this, and the reason that you don't eat this is because of the saturated fat, And the saturated fat is because, see, we eat too much sugar. And because we eat too much, all of that is going to keep us going in circles, because you have people that are way, way eloquent, and they say things in a way that make you, yeah, yeah, yeah. But see, none of that stuff makes any sense if it doesn't make you a healthier person. I'm not here to motivate you, but I would like to inspire you to change some of those habits so that you will be a healthier person, that you'll be a person that continues to take care of yourself with the better decision, better choices. What are you worried about would be another question. Are you worried about something that isn't allowing you to be all that you can be? So ask yourself, what am I worried about? Another question is, what new activities am I interested in, and what am I willing to do? So this is change your life. This will get you to start doing something that's different, and not to be associated with a life that you deem boring. There's no way in the world, with all this stuff that's going on around the world, and places to go and things to do, and all the different levels, even if you're not you don't have deep pockets, there's still things to do all over, and you have to be creative, and you have to be willing to be um, allow yourself to be adapted to the things that are helpful to you. We have a lot of adaptability, so let's use that. Now, another question, you suppose you say this to yourself, if I could have one wish, what would it be? What would that be? Think about it. If I had one wish, what would it be? And this will tell you what you've prioritized in your life. Let's continue. Where do I feel safest? Where do you feel safest? Now you're going to start really pulling things up, because now you thinking about, who you're going to be around, where you're going to live. Do you feel secure? Who's going to be a part of your team? All of these things are now going to come out. What or who gives me comfort? So the list goes on. If I wasn't afraid, what I would, you see, this way that you can start thinking about the importance of yourself. When you don't know what you are, when you don't know who you are, telling you what to eat doesn't make any sense. Look how many people were smoking cigarettes when they were pregnant. At a time that people, but we never stop having children. So we start, all the pregnancies that were actually believing in the advertisements about, here, smoke this type of cigarette and it'll make you have a happier delivery or a better delivery, or some lie that they made up. We got to get out of that. We got to get away from that, because if you don't, you're going to end up being right where you are now without any elevating yourself, getting better. Stay away from people that are not about feeling safer or being protected or being proud of themselves for some accomplishment. You want to be around people that also have values. And what do you believe in? They don't have to believe the same thing that you believe, by the way. Some of my best friends have nothing to do with what I believe, my belief, my faith. I have, people, I don't have to go, they don't have to go to the same church that I go to in order for me to respect them. And that's how it is when we grow up. A lot of times, I know in my family, I have part of my family is Christian, part of my family is Islamic, part of my family may have other beliefs, but that doesn't stop me from loving and respecting them. So let's throw that away altogether. What does my inner critic tell me? What does my inner critic tell me about myself? About my hygiene, about my kindness, about my willing to share, my generosity, my respect for myself. All of these are things that we need to consider. Now, once we get these things in place, then we have what is called confidence. Now, let me break it down to you like this. Confidence is knowledge of self, and confidence is the knowledge of the self. Well, I should say, and the knowledge of self is a clarification and inspiration to take care of your own needs. You'll learn to give to we learn to give to yourself, and in doing so you will develop into a person you strive to be, a person that you want to be, a person that you want to introduce yourself to a person. It's like you'll be glad that you met me one day. you know you're glad. You don't know what I am or who I am, but I'm sure when you find out, it's going to really make you pleased that we met. You'll celebrate the beauty and the freedom of being true to you, and you'll gain and solidify a sense of what you truly are. And this is what you should know: how much you can take. You know how much patience you have. You should know if you should get involved with that game or not. You should know whether or not you want to work where you work. Now, a lot of times we don't get a chance to think about this, because usually it's like, hey, I'm glad that I'm working. I don't need to, I'm glad that I'm working. I'm glad that I got a chance to work. That's huge. So I'm not going to be too fastidious about, to whom I'm working with or for. I'm just glad that I'm working. But as you grow, you will find that you, they're lucky to have you, and you start to look at it in a different way. If they're lucky to have you, then you can speak up for, no, I'm not starting at 68,000. My start is at 101,000. So you have more belief in yourself. So you're not afraid to say that, and you're not underpaid and just taking whatever they give you. What can you do? Whatever. You really being specific about yourself is very important, and confidence is the key. When you have that confidence, then eating here, let's go and have dinner, or let's share. The family dinner is huge, where everybody's eating something healthy as opposed to just good, and that really makes a huge difference. So we want to change that. You might not ever stop eating barbecue. You may not ever stop eating hot dogs. But what I'm saying to you is that you have a choice. You have a choice, and when you are ready, because that's the only time that is going to happen for you, is when you're ready. And that is that you um, choose those things that will improve your life. And when you're ready, you'll start to eat, sleep, dress, walk like, talk like, act like another person, or a higher person that really cares about him or herself. Okay. Now, some of the opposites, so you will get an idea, the opposites of what confidence is if you're uncertain, doubtful, dubious, hesitant, um, if you're irresolute, if you're tentative, if you're unconvinced or um, undecided. All of these things make you unclear as to what you want to be and what you want to do. So eating right is way down on the list somewhere, because all of these things make you weak in your stance, standing up for the things that you believe, and you just, letting life happen to you instead of you creating the life around you. Now, one of the things also that I wanted to go into as we continue to talk about this wonderful subject of understanding medical terminology is that we need to understand school and education. And this is what escapes us. You might have heard that saying, don't let your school get in, don't let your school keep you away from your education. or don't let your school keep you from being educated. Well, what does that mean? The basics of the difference between school and education is that school is a way to obtain education. Now, however, since people do not look at school and education in this way, school and education have become two words that often confuse uh, anyone that uses it, and it comes out with a different meaning or a different usage. Now, strictly speaking, these two words differ to some extent in terms of their senses and their usage. School refers to a place of education. On the other hand, education refers to learning or teaching. Now, this is the main difference between the two words. And I'll say it again, that strictly speaking, these two words, they're different, and to the extent in terms of their senses and their usage. School refers to a place of education. There's my school. And on the other hand, education refers to learning or teaching. So let's move on. So we know that education, let's look at education. Education is a process of learning or the process of teaching, though most of the time when we say education, we're referring to the learning and teaching process one goes through in an institution. Education can also be learning anything in life. You can be educated in the streets, you can be educated in gangs, you can be educated. Education, that's what education is. And when you educate it, he becomes refined by education. He has to attend uh, to a school in some part of his life, preferably the earlier part of your life. Like when you in elementary school, that's where you learn the most. That's where you get the basics. And this is once you do get this type of teaching or this type of education, then it sets some kind of premise for you to move forward and upward in life. Now, school is a place that offers education to people. Schools are established in every country in the world so children have the knowledge necessary to live in this world. Of course, if you don't educate your children, if you don't educate yourself, we're just left out to do things, to figure it out, and usually to make some what could be very dangerous decisions, and not having the protection as we know that when you know, for instance, the law, you feel more confident about a police approaching you, or you feel more comfortable about a situation that may cause for going to court, um, or getting someone out of jail. All of this and that knowledge really helps you to be a person that has more choices. Now, now you got it. We talked about the way that you feel about yourself. We went over some of the things that you should know about yourself and have a better relationship with yourself. We talked about some of the imbalances that we also have when we don't have the education and we don't go to school. So we want to keep those things in mind. Now, what's the difference between school and education? Again, so that we'll have a great idea. The definition of school and education, and that's one of the things. The education is the process of learning or the process of teaching. School is a place that offers education. The difference between school and education can be the nature of the school or the nature of education. Education is a process. It's also a profession. So there's people that are rich. Some of the richest people in the world, as a matter of fact, dropped out of school. So don't hold that against yourself. if you haven't completed school, but continue to educate yourself. School is an institution, keep that in mind. However, the word schooling refers to the process of education. So now we got that clear. There's more to it, but again, we want to continue to allow you to, just absorb this stuff, and then we'll continue. As we continue, we're going to go ahead and have Carolyn. Why don't you reset the room, and then we'll keep going.
Absolutely. Thank you, Dr. Zarif. This is Carolyn, and you are in the Mind of Nature, hosted by Dr. Zarif, the nutritionist. And today's topic is understanding medical terminology. So, if you can all share, let's see here, share on Facebook. If anyone's tuning in on YouTube, share on YouTube. I just saw in the comments over here on Instagram from White Snow said, "Good to see you, Dr. Zarif. We miss you in Clubhouse." So, I mean,
Cool.
it's cool. This is the new area. This is a new platform that we're using. Instead of Clubhouse, we are now on YouTube and on Facebook and Instagram. So, absolutely a great conversation, Dr. Zarif. Really enjoying it, and thank you to everyone for tuning in with
Oh,
us.
you got it. Thank you. Really
You're
appreciate
very
it. Thank you
welcome.
so much. So let's get into it, everybody. We're going to talk about the importance of the medical terminology. Medical terminology is important for a variety of reasons. It allows medical professionals to more accurately and precisely communicate with one another about the patient's condition. Now, it also provides a common language that can be used in medical documentation, such as charts and your medical records. Furthermore, understanding the medical terminology can help patients be more informed about their own health and better advocate for themselves. Finally, medical terminology can help students in the medical field better understand and retain a large volume of information that they have to learn. There are a lot of medical terms and abbreviations and acronyms, and I'm going to go over some of those things. So I'm going to say these things, and here is a chance for you to actually write them down and also refamiliarize yourself with some of the things that you know. We want to say thank you, everybody that's over here in Instagram. Thank you so much, White Snow 37. I really appreciate that. And we want to make sure that everybody is learning from what we're teaching today, because this is something that you can embellish the information that you already have. So let's start off with the terms. First is abrasion. Now, abrasion is a typical non-serious scrape or cut. So when you hear abrasion, like there was an abrasion, now you know what it is. A typical non-serious scrape or a cut. You might hear some doctors say, oh, it's superficial. Um, abscess. Abscess is a pocket of pus that forms due to an infection. So you will see this like in many, like they're trying to kill us. If you look at the movie They're Trying to Kill Us, they were showing a part of that film was showing you how the cows can be infected and animals can be infected, and they get a big old pocket of pus from that infection. And they although they have it, despite them having it, they still use the meat. They don't throw away the cow, like it's a piece of paper or something. They use that, and a lot of times they're sick, and we end up eating those in the form of lunch meat, in the form of other processed meats. Hot dogs are, scraps. Lunch meat are scraps. So, you have potted meat, that's scraps. You have um, Vienna sausages. All of those things are scraps, right? So we want to make sure that you are keeping we want you to stay alert, because when you go to sleep on these things, it's very, very hard to pull yourself back, because you do form a habit that's usually very deleterious, and you keep up those habits, and then you threaten the very life that you're living. So let me start off. Some of this stuff is just going to take me on a side road, so I'm going to stay focused here. Abrasion, again, remember, typically that's a non-serious scrape or cut. Abscess is a pocket of pus that forms due to an infection. Acute, when you hear the word acute, this means of short duration and or severe intensity. Acute, he had an acute pain, you see. Or you might say that this is just an acute injury, short duration. It's not like if you have a person that, for instance, chronic illness means also long duration. Benign, when you hear the word benign, it means will not cause cancer. It means that it's not cancerous. Biopsy. Biopsy means a tiny tissue sample used for testing purposes. Biopsy. When you hear biopsy, it doesn't mean I put this up here because this young man that I met, he was in the waiting room, as a matter of fact, and he said that he was really nervous because he was going to have a biopsy today. Well, after I explained to him what a biopsy is, he said this guy thought that they were going to do something to his brain. They thought he was going to go into some kind of surgery for his brain, and that was one of the things that, when it comes, ask questions and understand the terminology. It's up to us to make that difference. The word chronic means an enduring long-term illness. Contusion means a bruise. So if you have a bruise, it's a contusion. That's the word you want to listen for, and that it means a bruise. Defibrillator. Now you hear more of this every day. Why? Because more people have heart problems. A defibrillator is now they're very, very popular. It's a device that restores a normal heart rhythm. Okay, and some people walk around with defibrillators. You have edema. You hear that more, especially for people that are losing weight. You know, when you have edema, excessive fluid is in the body tissues. Embolism. Embolism is an arterial blockage of blood flow. Now you will hear people saying emboli, and the emboli means plural, and there may be emboli or embolus that travels through the body that can threaten the body's health by forming clots and causing aneurysms. Hypertension means high blood pressure. Inpatient, a patient admitted to the hospital. Intravenous means the fluid or the medication delivered through a vein. Malignant means cancerous. So this is super important for you to remember. Let me see if I can just, for a second here, I want to bring this chart up so you can see it if I can. Okay. So what do you guys think so far? You know, please leave us some comments to let us know what we need to do and what we're doing, how you actually, here you go. I'm going to share screen. Okay, window. Hold on just for a second. I'm almost there. Yeah, I got that. Terminology. Okay, good. I should be able to see that. Now you guys can see this, right? Let me see. That's not what I wanted to share, though. There you go. Okay, Carolyn, let me go to you. Do you see the understanding medical terminology notes? Oh, Carolyn? Okay. Hello, Carolyn,
Yes,
can you see that?
yes.
Good.
I can see
We're
your,
up.
your share screen.
Beautiful. Okay, so we have okay, let me see. Okay, so we're over here on this list here. And we're talking about, let's go here back to inpatient, intravenous, malignant, outpatient, prognosis. Let's start at prognosis. Prognosis is the prediction, the predicted result of a disease's progression. The relapse is the reappearance of a disease or symptoms after a patient has recovered. Sutures, you might have heard this before. The sutures are stitches. Transplant, the process of removing an organ from one individual and placing it in another. Vaccine, a substance that promotes antibody production to boost immunity against disease. And zoonotic. Zoonotic is the zoonotic disease is a sickness that is transmissible from animals to humans. You hear a lot of people that have dogs and monkeys and other wild animals that this zoonotic disease, this is where that may come up. Now we're looking at suffix or suffixes and prefixes. And this is important to know too, because this helps you to understand the words here. Let me see. Are you looking at what I'm looking at here? Let me see here. Move this right here. Okay, Carolyn, can you see this? The the suffixes and the prefixes. No. I don't even hear you. Oh, that's because you're muted.
Oh, I'm so sorry.
Okay.
Let
Go
me
ahead.
get that right. What are you asking me?
I was asking you, do you see the suffixes and the prefixes list?
No, I don't. I see where it says terminology
Oh,
and
okay.
it's highlighted. Maybe it's frozen.
Doggone you, Frozer.
It's weird
Okay.
that it's frozen because usually if I can see you now,
Let me
it
just
should
go
be
back
able
to
to show
here.
it.
Slides, video, stop screen. Okay. I'll just go stop screen right there. Okay, let's continue. So let's look at the suffix. Okay, so when we're talking about that, we're talking about the word a. If you take a or an, that means without or lack of. A or an means without or lack of, like asexual. A means without. So a asexual person is a person that it means without or the lack of sex. Asexual. If you have Asian, Asian in the word, it means the process. It's the process. Like if you're talking about anything that you have Asian on the end of, like summation, okay, is the process of summing. So there you have it, Asian. And then this is usually a suffix, a prefix, and that's dys, dis. And dis, it means painful or abnormal. And then you have autonomy, or you have the expression of this is another way to have a surgical removal, ectomy. So you have ectomy, that's a part of, like, um, it can be, if wherever that word shows up, you'll have, like, uh, um, pancreatectomy, or you'll have something that would express the removal of something through surgery. And then next is isthmus. And this is usually on the end, especially like the presence of a spasm or contraction. Itis means inflammation. Itis means inflammation. Like, you will hear something like pancreatitis, and then, or you might hear things like pancreasis, or you'll hear um, something like if you have in your digestive system, if you have colitis, and you hear all of these are like different types of um, different inflammation, or it'll be osis means that it is an infection, and itis is that is inflamed. Lysis means decomposition. Macro is large. Uh, if you have melon or melano, this means, like, you can think about melanin. So that word melan, it means dark in color. Micro means small. Uh, Ology is the study of a certain field. Osis is the indicates that it's the presence of abnormality. So when you hear somebody say that that person has tonsillitis or tonsillosis, or is some kind of abnormality there. And otomy, which means to cut. And then you have pathy, which means disease or disease process. Plasty means surgical repair. Poly means many. And you've heard that we've talked about polysaccharides, for instance, many saccharides as opposed to monosaccharides. Pseudo means false or deceptive, just like we have many people that are going by pseudosciences, for instance. Retro means behind or backward. The cardi or cardio is related to your heart. And derm or dermat or dermato or derma, all of those are relating to your skin. And then you have encephal or encephalo. This is related to your brain. And there's many, many more there, but I wanted to make sure that I gave you those. There's other things that you're going to get when you go and get your checkups in the hospital or the clinic or urgent care center. You might hear ALS. That is an advanced life support. Now, there's an equivalent that we use as individuals, like, and that would be CPR. LAS is usually a little more in depth. Then you have BL, and you're usually going to have a WK after a BL. That means blood work. I really think I should have taken some more time and put some time into helping you to read some of the stuff that you get in your CBC. Perhaps we'll do that at another time. But these are just some of the things. Your PT is a physical therapist or a physical therapy. When you see the capital R and small x, that stands for a prescription. When you see the word lights, LYTES, that stands for electrolytes. LDL stands for low density lipoprotein cholesterol, also known as the bad cholesterol. And HDL stands for high density lipoprotein cholesterol, also known as the good cholesterol. HR simply means heart rate and is written in beats per minute, or BPMs. C spine or C dash spine means the cervical spine. DNR means do not resuscitate. And that list goes on. So some of those you can always play this back and you can get as many as you can. And keep in mind that the more that you know how to um, communicate with people, the better. The better. Okay. Eclipse says, Dr. Audio when Carolyn speaks is not clear. Okay. Carolyn, turn up your mic or see if you can be a little more clearer. Ellipse said that she can't understand what you're saying there. We want to welcome Malika is here. Malika Cox, C. Cox is here. Thank you so much for being here. And we definitely want to thank Sky Aim Productions for all the beautiful things. Something we'd like to see the screen, please. Okay, beautiful. You can definitely everybody. We're talking to everybody on YouTube and we're on live Facebook and Instagram. So welcome you all and thank you so much for making this wonderful. Okay, move appendix, appendectomy or appendectomy. Okay, this first lady was appendectomy is to remove the appendix. Okay, beautiful. So I think I might have said, I don't know. I think, oh yeah, I was saying, I was searching for something for the removal of the appendix. First lady is also a nurse, so got some backup, and that's really good. With all of this, I'm and talking about this is like I wanted to go over these things, everybody, and I think the other thing that we can agree with is that you can't be afraid to make a mistake. Go out here, you're going to learn these new words. Don't get just locked in words that you've said for years. There's going to be mistakes. Nobody knows everything about anything. And when you make a mistake, then you might have a first lady by your side to pull you through. But in the case that you don't, you need to study. Take time to read, get back to now we do everything by just looking at it and taking what we see online. But there is another way that we can learn, and that is to read. For now, let's see if we have any questions about some of the words that some of the words that we didn't go over, and that was like when we have, for instance, polyuria, and that is to urinate. Poly means many, and urea, of course, is talking about when we urinate. So when you hear that word, that's a person that's probably urinating about every 20 to 30 minutes. And then you have nocturia. Nocturia is during the evening or nighttime. And when a person is, when you hear the word nocturnal, it's usually referring to nighttime. And some people have interrupted rest, they have interrupted sleep. And what's interrupting them is the urge to use the bathroom. So we have to get that, especially guys. So if you have prostate problems and you're just up and it's got you up all night and all that, there are wonderful approaches that are getting better and better for that. So it's really important that you learn more about yourself. Learn more about yourself, and it ain't a thing. If you don't know, how do you start? How do you get to know? You get to know by starting off. You just take a little pinch of it, and the things that are important, they'll stick, and other things, over time you'll forget them altogether. But remember, you're only sick as your deepest secret. Don't allow things, and I mean, there might be some things that you don't want anybody to know. Okay, I grant you that. That's cool. But if you are a person that is holding something in and is hurting you, is breaking you apart, is making you sad, is making you depressed, you need to seek help from a professional. So you can get, there's all types of therapy that you can sit down and talk about those things. And you start off with that type of therapy, or there might be something else that they suggest. But there's things that you can do to start improving your life. And one of the things is to know you better and understand that when some people say, no, I know how I am with that, that is a reflection of them knowing more about themselves. The reason that is so hard, you have people that have been married for many years and build a beautiful family, and they all, they have their challenges just like any other humans, but they're still together over all that time because they've been really clearly defined by sticking together through it all, the happy times as well as the difficult times. Knowing yourself is super important, knowing that you need to have people that support you. And know that those people that say, I see you, that you count, you really matter. And stop, we need to stop that, blame thing. And this way we can really enjoy more about ourselves. We can really understand more about ourselves, and we can then be in a position also to help others. It's really important that we take time to do the things that are helpful to ourselves. Once you love you, once you understand you, and I'm not talking about narcissistically, I'm talking about loving you because you understand what you are now. You understand who you are. I don't want you to get too caught up in who you are, because the who you are is hey, Chantel, but that is the thing that we need to do. We need to find out what we are and who we are. And I'm really, really thankful that we can get together on these times so we can sit and talk to each other and share. I really want to work on First Lady. I want you to start, when you get a chance, like that'd be great for you to come up and be on the show with us and talk about some of the things that you feel and some of the things you want to express. It'd be great to have family up here, and anybody else that want to come up on the stage, please do the same. Also, it'd be really wonderful to have you here. And thank everybody from that East Coast. Thank you very much for being up, getting up. Now I want to go to Carolyn in case you have something to share before we get out of here.
Yes, just reminding everyone to uh, subscribe to the YouTube channel and like and share. That's the only way we're going to grow. Don't keep Dr. Zarif a secret, okay?
Yay! Well
We
said.
want to be able to, yes, we want to be able to share with him as well, or share him with others as well. So that's the information that I had here. Who's this here? We got Charles Frazier saying hello, Dr. Zarif. Hey,
All
Charles.
right. Charles Frazier in the house. Oh man. Oh, Charles Frazier. Oh, sorry. Was that real loud? It was loud in
It
here.
was loud, yes.
Okay, I'm very sorry. I pushed over those people in Instagram. We're back in action. I was going to show you this book here. This is a book that Charles just gave me. I think it's probably blurred. But anyway, it is called How Doctors Think. And thank you very much, Charles Frazier in the house. I love him. I love him. He's a wonderful human. And it's really, really wonderful to know this brother. You talking about an exceptional brother. He's really incredible. I really want to think, as far as, like we are talking about, one of the things I want you to remember is the support group. We need you to allow a support group. I don't care if it's two people, one person, you need somebody. You cannot do it all on your own. So as we were talking about this earlier, the support group, just like I'm saying to my cousin, shoot, we're going to get her on up here. And if you are a nurse or you are a medical professional, and even if you're not, if you're a person that you're just good with understanding how to eat properly, or you don't even know it, as much as you want to, you can start right here, and let us help you as you go through it and you understand it more clearly. But all of you are very important in getting the news out to people so that we'll stop doing the things that we've done over the years. And the things that we've done over the years, we continue to eat those slave foods that it says for me to tell you that we're not in slavery anymore. We don't have to eat like that. Those foods are usually foods that people eat when they're desperate or they're in a state of desperation, a state of urgency. We don't have to eat like that. We have a choice now. We have fruit, produce every day. We have all the different types of grains and nuts and all types of. If you're still cooking out of a box and you're making a mix and then you're putting it in the oven or something like that, don't worry about it and don't be so hard on yourself, because these are phases. If you're still frying but you reduce the amount of grease, that's a stage, and it's really going to take more and more of these realizations that, if you're still eating cow or you're still eating pig, all of these are phases. But have your goal ready so that you'll say, on this day, I will discontinue to eat this way. On this day, I will, even if you start before you go to the long term, say short term, you can say, on Monday, Wednesdays, and Fridays, I'm going to eat all vegetarian foods. Just start. Don't even worry about it and get all super technical. Just know that you won't be eating dairy products and you won't be eating meat. That's on those days. Or you can change it around and do it Tuesdays, Thursdays, and Saturdays. See, and find out something that works for you, but just don't allow it to happen to you. What am I talking about? Disease, illness. And we're talking about the different types of infections and death itself. If you don't do something about it, it will happen. It is happening. So you don't want to just be a target for anything to occur, anything to happen to you. Okay. So let's see if we have any. Yeah, he's never a secret over this way. Ha. All right, Chantel Heath in the house, one of the most incredible choreographers on the planet. I just really check out, follow Chantel and check her out. She does some really incredible things working with the children. She's been doing that for years. Chantel used to be my student, and she was, I believe we were in middle school. And yeah, and now she's her own. She's definitely a great leader. So thank you all. About I would love. I got to get a Diva D up here too, because she's a show within herself. So we definitely got to get our best up here. So glad. I'm so glad to see First Lady Sarita is just so really wonderful. And everybody else, thank you very much for being here, and we really enjoy sharing. Any last closing words before we get out here? We're going to also mention to you to go out to farmers markets and make sure you support those farmers in that's doing a lot of work to bring us the fresh foods. Thank you so much. Sorry again, Instagram, for that mistake and falling and stuff everywhere. But mistakes happen. That's the way it is. But anyway, I want to say this is really, really important to get us off the ground to start doing better. And people that are being very helpful, I really appreciate you all the time. Let me see. We have here, hi, Cliffs. Okay. I'll let them deal with that. Let me see. Okay. Okay. All right. I just wanted to make sure that I wasn't missing anything. Here, let me give you some homework, please. The thing that I would like for you to do is thank you, First Lady. Thank you, First Lady Sarita. I love you too. I want to just get everybody to look, the things that we went over today. We don't say them enough. You got to say them in order to really get used to them. You cannot remember their specialties. Don't worry about being an expert. Just start. Start and remember that you're not worried. You're going to learn more through, different mistakes that you're going to make. So that's okay. You're going to slip up and you're going to eat something that you like. I shouldn't have eaten that. That's going to happen a lot until you do it enough for it to be automatic. Practice doesn't make perfect. It makes automatic. So make sure that you keep that in mind. And there's a thing too that I want you to keep in mind also, and that is to make sure that you commit to yourself. Commit to yourself to take time for yourself. Commit to yourself to get stronger. Commit to yourself to live life fully, okay? And this will be the beginning of the greatness that you are. Have a beautiful, wonderful weekend, everybody. We'll see you next Saturday. Carolyn, go ahead and let's give him the closing remarks, if you will.
Absolutely. Thank you, Dr. Zarif. And thank you to everyone for joining us here in the Mind of Nature. Our mission is to bring awareness, listen to your feedback, and now it's time for you to take action. Our time, we're going to meet every Saturday, 8 a.m. Pacific time on YouTube and on Facebook as well. I know on Instagram, we are on Instagram, but the audio may not be as good because, we're just using more going through YouTube and Facebook. So I would encourage everyone to go on the YouTube channel and look at the different videos that Dr. Zarif has up. He has a new one coming up. It's more of a vlog style, and it's like on your colonoscopy journey, right, Dr. Zarif?
Yes.
That you had. So that's going to be edited shortly and uploaded. But for right now, let's go ahead and look at all the other videos that we have there on YouTube. So that is the closing remark. Again, we meet on Saturdays at 8 a.m. Pacific time. So that is my announcement.
All right. Well, thank you so much, Carolyn. Really appreciate it. Love you all. Thank you very much for tuning in. And we're going to see you next week. And for now, I'm Dr. Zarif and Carolyn Gento. I say her name for her. So I guess she. Let's get it. Let's do it, Carolyn. Here we go. I'm Dr. Zarif, the nutritionist, and
Carolyn.
Yeah,
we have to work on that sign off because I'm not sure what you want us to do right now.
No, it's just you just don't say I'm Carolyn, co-host or something like that.
Carolyn,
I just want you to say something.
Yeah.
That's funny. Okay.
We'll work on that.
Yeah, we'll work on that, y'all. All right. See you later. Take care. Peace.